Question number 1. An 11-month-old girl is brought to the emergency department with frequent diarrhea. Her mother reported that she passed loose stool 7 times since the morning. She seems to be thirsty and irritable. Physical examination revealed dry mucous membrane and poor skin turgor. Heart rate 150 beats per minute. Respiratory rate 35 breath per minute. Temperature 37.1 degrees Celsius and weight 8 kg. Which of the following information is needed to assess the type of dehydration for this infant? Options. Option A. Age of the infant. B. Frequency of bowel movement. C. Physical examination findings. D. Serum sodium level. So here the correct answer is option D. Serum sodium level. So this helps to determine if the dehydration is isotonic or hypertonic or hypotonic. So this will be guiding the appropriate treatment for the child. While age, frequency of bowel movement and physical examination findings that is provide valuable content, the serum sodium level is essential for accurately diagnosing and managing dehydration, and it's ensuring optimal patient care and outcomes. Question number 2. When would the nurse schedule a woman for a glucose tolerance test? Options. Option A. 6 to 10 weeks of pregnancy. B. 12 to 16 weeks of pregnancy. C. 24 to 28 weeks of pregnancy. And D. 32 to 36 weeks of pregnancy. So here the correct answer is option C. 24 to 28 weeks of pregnancy. This test is commonly performed during this time frame to screen for gestational diabetes. So there is a condition that can develop during pregnancy and affect the blood sugar levels of the mother. So screening for gestational diabetes during this period that is allowed for timely intervention and management if the condition is detected. Question number 3. A nurse is conducting an assessment of a pregnant patient who is suspected of having preeclampsia. Among the following findings, which one would be the most concerning and indicative of severe disease that requires prompt medical attention? Options. Option A. Edema in the lower extremities. B. Blood pressure of 140 by 90 mm of Hg. C. Proteinuria. And D. Epigastric pain. So here the correct answer is option D. Epigastric pain. So epigastric pain that can be an indication of severe preeclampsia or HELP syndrome, so that which require immediate medical attention. Okay, let me see what is meant by HELP syndrome. Syndrome is nothing but hemolysis, elevated liver enzymes and low platelet count. Okay, so here H means hemolysis and E means elevated and L means liver enzymes and the L means low and P means platelet. Okay, so that is nothing but hemolysis, elevated liver enzymes and low platelet counts. Question number 4. What is the most appropriate nursing advice for a primiparous mother who has breast engorgement and complaints of pain during breastfeeding? Options. Option A. Massage. B. Cold compress. C. Analgesic ointment. And D. Warm compress. So here the correct answer is option D. Warm compress. So the warm compress can help to promote milk flow and to relieve discomfort associated with breast engorgement. So they can also help to soften the breast tissue, making it easier for the baby to latch on properly during the breastfeeding. The cold compress may be used after breastfeeding to reduce swelling, but the warm compress are typically more effective for addressing the engorgement and pain during breastfeeding. Question number 5. A client having multiple sclerosis is experiencing bowel incontinence and is going through a bowel retaining program. Which strategy is not correct? Options. Option A. Eating a diet high in fiber. B. Setting a regular time for elimination. C. Using an elevated toilet seat. D. Limiting fluid intake 1000 ml per day. So here the correct answer is option D. Limiting fluid intake 1000 ml per day. So limiting fluid intake to 1000 ml per day, that is not a correct strategy for bowel retaining, in a client with multiple sclerosis, so experiencing bowel incontinence. So in fact, the adequate hydration is important for maintaining bowel function and preventing constipation, and which can exacerbate bowel incontinence. Question number 6. During a routine prenatal visit, a patient at 30 weeks of gestation complains of persistent headaches, visual disturbances, and swelling in her hand and face. So what is the most likely diagnosis that the nurse should consider? Options: Option A, anemia; B, gestational diabetes; C, preeclampsia; D, hyperthyroidism. So here the correct answer is option C, preeclampsia. So the persistent headaches, visual disturbances, and swelling in the hands and face are the classical signs of preeclampsia. Question number 7. Which is the best way to assess the fetal condition of an uncomplicated pregnancy during the antenatal period? Options: Option A, daily monitoring of fetal heart rate by Doppler; B, daily recording of fetal movement on a kick chart; C, weighing of the pregnant woman with every clinic visit; and D, performing a non-stress test with every clinic visit. So here the correct answer is option B, daily recording of fetal movement on a kick chart. So the best way to assess the fetal condition of an uncomplicated pregnancy during the antenatal period is through daily recording of fetal movement on a kick chart. So the simple method that is allows pregnant women to monitor their baby's movements regularly, providing valuable insights into fetal well-being. Other methods like daily monitoring of fetal heart rate or performing non-stress test with every clinic visit may not be necessary in uncomplicated pregnancies. Question number 8. A 25-year-old client is admitted to the emergency department with sudden onset of right lower abdomen pain. Which of the following physician orders should the nurse question at this time? Options: Option A, apply heating pads to the abdomen; B, obtain abdomen X-ray; C, start intravenous dextrose 5%; D, nothing by mouth. So here the correct answer is option A, applying heating pads to the abdomen. So in a patient with sudden onset of right lower abdomen pain, the nurse should question the order to apply the heating pads to the abdomen. So this is because the heating pads can increase the blood flow and may not be appropriate if the patient has appendicitis or other conditions that require surgery. Question number 9. A pregnant woman at 37 weeks gestation presents with a sudden onset of sharp unilateral abdominal pain and signs of shock. Considering these symptoms, which obstetric complication should the nurse suspect and prepare to manage urgently? Options: Option A, appendicitis; B, ectopic pregnancy; C, placental abruption; D, uterine rupture. So here the correct answer is option C, placental abruption. So the sudden onset of sharp unilateral abdominal pain accompanied by signs of shock is in the third trimester, that is indicated of placental abruption. Question number 10. While interviewing a client with schizophrenia, which behavior requires immediate interventions? Options: Option A, rocks back and forth in the chair; B, muscle spasm of the back and neck; C, shuffling gait and stooped posture; D, lip smacking and frequent eye blinking. So here the correct answer is option B, muscle spasm of the back and neck. Muscle spasm of the back and neck could be indicative of acute dystonia, a side effect of antipsychotic medications. Okay, that is commonly used to treat schizophrenia. Acute dystonia, that is a medical emergency and requires immediate intervention to prevent further complications. Okay, let me see the other options, that is option A, C and D, that may indicate symptoms of schizophrenia or side effect of medications but are not typically considered medical emergencies. Okay, so it is requiring medical intervention.